Hi, I'm Jillian Rader, and welcome to Lincoln Park Zoo's podcast. And today I have with me
Dr. Kathryn Gamble. I'm Director of Veterinary Services.
This is going to be a very complicated question. In the simplest terms, what do you do?
So I think the important thing about being a veterinarian is we don't just take care of animals, we take care of people too. It's part of our oath that we're responsible for the health of the people that take care of the animals, the people that might visit the animals, as well as the animals themselves. But our primary job is certainly animal wellness, animal care, and fixing things that go wrong. So
it's all encompassing.
All the things.
And I have to toot your horn for you.
Okay.
You were the first ever person to be double boarded by the American College of Zoological Medicine and the European.
Well, not quite the first person in the world, but there were 7 of us that were the initial kind of people in the European College of Zoological Medicine, and several of those people were double boarded in ACZM, which is the American College of Zoological Medicine. But I happened to be the first woman and the first American in the European College of Zoo Medicine, so that may be a little bit of a first. So we had kind of the Snow White and the 7 Dwarves going on there for a little while. So.
And what does, in addition to being double boarded, what does the vet process look like? If someone wants to be Dr. Kathryn, what does their schooling look like?
I would not encourage that at all. So I think the important thing is it begins back whenever you first make that decision, and if that's in elementary school, like for myself, or junior high, or into college, wherever it is you make the commitment, it's to make sure that you're prepared for all the different things, the different species that you might encounter. And then the process becomes fairly typical regardless of what species of veterinarian you want to be. So zoo vet, or horse vet, or cow vet, or dog cat vet, we all need to go to kind of a baseline college where you need to learn the basics, the maths, the sciences, and all the things. And then you are accepted into veterinary school, and there's just under 60 veterinary schools recognized across the world by the American Veterinary Medical Association. There's more coming online because there is an increasing need for veterinarians in the United States.
It's actually fewer than I would assume.
And when I started my schooling, there were actually fewer than 30. And so we've grown since then, and we've actually accepted colleges, like I said, that are outside of the United States. There's some in Canada, the United Kingdom, Mexico, where we have kind of cross recognition with our schooling standards. But what's important about all of that is if you think about it, that sounds very similar to like a doctor, right? Yeah. So there's 4 years, but after that is where we kind of start splitting up a little bit. But the more specialized you want to be, so zoo med or cardiology or whatever, you tend to go that route. But then after that, then you go and become a veterinarian. So it's an extended process because in vet school you learn about dogs and cats and horses and cows and pigs and goats and sheep and chickens. And the only place that those exist here is at our farm.
Sure.
So.
And many people don't know, we have a team of vets and vet techs, and then also we have a hospital here on grounds.
We do.
Which is very interesting. And if you could just give a sort of an overarching breadth of the species that you work with. We've got tiny cockroaches and giant eastern rhinoceroses.
Right.
So what's kind of the spectrum of taxa and size that we're really working with here?
So we have somewhere between 220 and 250 species at any given time on grounds, and somewhere between 700 and 850 animals, depending on how you count the cockroaches. I'm sure you could make it even more, 2,850. But basically, those are divided almost kind of, each part is like a third by species, and then a third by by types of animals too, where we have 30% of the 240 are birds, but it doesn't mean that we have that, like there's 50 flamingos, for example, right? And that kind of counts as one species, right?
Yeah.
So, but we do have a pretty extensive variety of animals that we deal with on a daily basis. And one of the things that I did when I first graduated from veterinary school and was doing one of my first jobs, I was on duty one Saturday by myself and was in the reptile building working on a rhino iguana, and then got called to deal with a rhino hornbill, and then got called to deal with a rhinoceros. And so, I mean, you move from one group of animals to the other. Our hospital, we do most of the smaller animals, medium-sized animals in the clinic, and then the larger animals we do outside of the clinic because it's safer for them and safer for us to stay in their own space.
Yeah, that makes sense. Which I also think is interesting. Yes, we have a hospital, but a lot of procedures, like a polar bear, we're not going to transport them to the hospital. So their spaces are built to be able to accommodate for that as well.
Right, so our bigger animals, their spaces are built to accommodate the veterinary team being in their presence under anesthesia, but we also are an ambulatory facility, so anything we can do in the clinic, we can do out in the field. If we feel like we need to bring the animals back for a particular reason, we can if we need to. Probably the only ones that we can't are things over 1,000 pounds. We have had the polar bear in the hospital when we needed to, because we've had 2 of them in there because there were situations that required it, but we tend to not do that. Usually our cutoff point is about 500 pounds. But we can do sterile surgery in the field. We can do radiographs, x-rays in the field, and make sure that the animals receive the same standard of care, whether they're in the hospital or it's a little more temperature controlled and comfortable for us versus their area, which can be, we have to make some accommodations to it.
Sure, but that makes sense.
Yeah.
We've talked about this, you and I, a lot, and I just find it so fascinating, is just the modeling aspect. So you can kind of base great ape care on humans and different, like a giraffe on a horse or whatever, or maybe a cow. So how does that work, and how do you provide care for something that has no model? Or
Sure.
How do you find the closest thing?
So we generally start with anatomy and physiology, and like I said, I listed the 8 species that we deal with in veterinary school, but that's why I actually strongly recommend to students who want to be zoo vets to not do what we call tracking in vet school, which is where you create this individual track and you do 8 different zoos. You'll have plenty of zoo experience. What you need is actually baseline anatomy, baseline medicine, baseline whatever it is, and surgery, for example. You need to be able to comfortably do surgery on anything, and you're not going to have experience in surgery in everything before you're faced with that, so you need to know what that model is, and you need to be comfortable, right? So, we use those models as, a starting point. But one of the things that's really interesting about working in a zoo is we take the entire globe and we consolidate it to 35 acres. So a lot of our geographic barriers no longer exist. So that can be really interesting from a perspective of modeling, that what you think of, like for example, up where a penguin lives, south of the equator towards Antarctica, right? So South Africa and lower, their natural history doesn't expose them to mosquitoes. And when they're moved into other habitats where mosquitoes exist, their natural history, their evolution has not allowed them to accommodate to certain parasites that are very common here in our birds, and actually are fatal to penguins. So we have to adjust and accommodate to that. So that's them moving into a small world here. But that'll happen anywhere in the world. It doesn't matter whether it's Lincoln Park Zoo or Zoo Maryland or whatever. It's wherever they are, right? But the other thing that's interesting is it breaks down, like, for example, we have our penguins housed adjacent to our polar bears, which is Antarctica and the Arctic Circle side by side. And so we have to think about what goes on there as well. And so sometimes we see challenges there where we're like, things you would normally not put on your list, we call it a differential list, which is what are all the choices that can be. So you walk up to a habitat and you're like, okay, the animal is limping, but we know there's many things that can cause that, not just an injury or a trip or whatever. We need to look at all the different things. So we model by taking that information from a dog or a cat and apply it to a wolf or a tiger, for example. But little cats aren't big cats. They're actually in different genuses. So we have, Felis and Panthera, and we know there are differences, things that you can do and utilize for caring for a small cat. Not just the size of them, but the species of them actually has a bearing on what we can do and not do. and things we are concerned about, things we might want to put on our list or take off our list. But we use that, and then we have situations like you mentioned where what is an aardvark? You know, an aardvark
What is an aardvark?
is you know, a kind of heterothermic mammal which means its body temperature moves around and more like a reptile instead of like us, where we have more of a homotherm. They're true homeotherms where they maintain their own body temperature, but they do have a little more variability than we're used to. And what do we do with that? You know, and what are they? You know, they're insectivores. What are their stomachs like? What is their metabolism like? So we have a variety of things that we have to do with that, but we still sometimes have to be on the edge of what no one's done before.
Yeah.
And that's part of the reason that I chose to do my graduate degree in pharmacology, because that's basically the study of how animals and medicines work together. And if you don't take that into account, you're going to wind up in a situation where you're either not helping or you might even be hurting the situation. And we don't want that in any place that we can.
Yeah.
So,
can you talk a little bit about the preventative exams and vaccines?
Mm-hmm.
If are different species on schedules, who gets them, who doesn't?
Right.
Are most animals voluntarily participating? Are some not? How does that work?
So we work through it with each of the areas, and you know, some animals are on an annual evaluation, and some are on every other year, some are on 5 years. It just depends on what the species is, and we work out a plan, not just from the basis of what the medicine is that they need, but also what the species trends are and what the animals here are doing. So for example, if we know that a group of animals is going to be in a reproductive setting, we will, before the reproduction starts, work all of the adults up as a preventive medicine, make sure everybody is healthy, such that once they start having babies, we know what their health is. So we don't have to worry about the little things, you know, what are they doing there, what's going on, or once the babies have arrived, we can leave the group undisturbed. And we may say that usually these animals are on every year, but when they have babies, we're going to extend it. Yeah. And then when the babies are 1 year old, then everybody gets worked up again, because that is just respectful of the social structures and the social needs. Doesn't mean we don't intervene sometimes. You know, one of our macaque babies, he was very young, and our intention was fairly hands-off, because not only we have kids, they're also very strong seasonal breeders, and so they get kind of a little bit fun during that, and so we had
big feelings.
We had big feelings, and we had babies and all that. But this little one kept, like, he had a swelling on the side of his face, and it was getting bigger and bigger, and he was becoming uncomfortable, and you could tell it was difficult for him to nurse, and so we had to take mom and baby, because mom wasn't going to give him up.
Sure.
And so we anesthetized both of them, and you know, at a very young age, he already had an anesthesia on the books, and it's because he had found some plant that he decided was interesting, and he had stuffed it into his cheek pouch. Well, it happened to have one of those seed-ons that, you know, and so it was like sitting there burrowing into his cheek, and so we had to take that out and clean it up. And once that it was all great, but you know, he apparently did not learn from that, and started using, you know, his cheek pouch to store other things, and so we you know, had to adjust some environmental things for him, because he was just too inappropriately curious. So we adjusted that.
Cool.
But yeah.
We've talked about a lot of how we got to this day and age of hospital and veterinary medicine. What do you think the future of veterinary medicine looks like? And I'll tack that into with, like, what does the future of a zoo hospital look like? Or
Sure.
What direction is that going?
So, you know, when I started practicing, it's almost been 35 years ago, we had a very lousy ultrasound machine that was a donation from somebody, and now I have 2 ultrasound machines that, you know, if I don't have them, it's a bit of a problem. And then I have a third one that floats around that's like backup. And we have 4 radiograph machines. Again, you have 1 X-ray machine, like 1 generator, and that's all you had. And we have a great relationship with a consulting practice that we're able to get advanced imaging, so like MRIs and CTs. But the CT imaging technology has changed dramatically in the 30 years I've been practicing. And one, we need it more. My first years in practice, I actually went to a human hospital because there was no veterinary hospital that had that. And for us to be able to go, we had to go, in the middle of the night, in between all the patients. And now we still go at weird hours because we want to get out of their way, but we go to a veterinary hospital and utilize that imaging. But there are certainly situations here that we would look for that technology more quickly than I think we would have in the past. And it used to be kind of oh my gosh, that zoo is the first, second, third. Now, a lot of zoos have them. So as people are building out, that's one of the things that we have to design into it. But we have just a lot of equipment that is continuing to evolve, and more of it is becoming Wi-Fi driven, more and more of it is electrical driven, but has to be charged. Like, it may be a battery pack, but it has to be charged. And so our current facility was built 35 years ago and isn't really modernized in that way, just even the infrastructure. So moving to that is going to be kind of a modernization of, like, what do we think the next generation is going to be? What is that going to look like? What's the equipment needs? What are we going to share with other people? What are we going to do? But we continue to train residents here and making them prepared for the next whatever that is. And I think one of the things that I've seen really happen in the last even 8 years that's become very evident is the individual medicine is really advancing quickly. And what used to be we've made this diagnosis and we are at the limit of what we can do, or we try it, but there's a gap between what we could do and what we can do. That gap is narrowing now, and there's lots of things that we can and could do. So that is taking, like, a veterinarian entirely offline for 2 and 3 weeks to do the preparations, to do the actual procedure, to do the aftercare. So needing some spaces that we can do different aftercare. We prefer to do it in the building so they're with their families, but sometimes that's not practical.
One thing that you have done, which I think is pretty incredible, although everything you do here is incredible, is blood banking for great apes. Can you tell me sort of what that is and why it's important, and how you came to that realization that was something we could do?
So currently, whole blood banking for apes in general is a virtual concept. We do, as the veterinary advisors for the ape species, encourage plasma banking, but that still ties back into what is your blood group, or as some people say, what is your blood type, right? So when I started my practice space, I came into a situation where I was going to be doing a surgery, and the animal had the potential of losing, it was a gorilla, had the potential of losing a lot of blood. And I was an associate, and I asked my senior veterinarian, what is her blood group? What is her blood type? Have we done that? And he's like, well, that doesn't exist, which seemed odd to me because it was the 1990s. I'm not that old, and I knew that we had worked out blood groups using blood from apes to help us determine our own ABO group. So it seemed a little of an oversight, in my opinion, that my own patients could not have that. So I did what I could do to have blood available for her, but not really knowing if it was the best choice and things like that. But then a few years later, so right before I moved to Lincoln Park in 2002, it happened again, and I was like, well, surely someone has done this. And so I went looking, and sure enough, no one had done it. And so I asked my supervisor again, I was like, why hasn't this been done? And his response to me was, it would just be this huge effort, and who has time for that? Who's going to make time for that? So then I got here, and in 2004, 2 years after I got here, I'm hit with a similar situation. I have to put an animal on dialysis. I'm having to take blood type. I'm having to do blood. We still didn't know, and it came about because one of the keepers in the gorilla area, she was very close to all 3 of the gorillas, the 2 that were sick, the one that was the blood donor. We lost one of them because it was a fatal infection. We got the other one through it. But she came to my office and she said that she wanted to quit because she was just so depressed about all of the challenges, and that it just, there's just no happiness to it. Like there's no end to it. And I said, let me take all that negative energy, and I want you to go on a journey with me because I'm going to need some help. And she and I became best friends at that point, and we started working through, what that looked like, right? And we ultimately got blood grouping done with genetic validation on over 600 animals across the globe. And yeah, it was a lot of work, and yeah, who's going to have time for that? But we made time for it, and we published that in 2011, and we basically created this virtual blood bank, which means, and she's left us sadly, but she still maintains that book, and people will send me the blood type cards so that I know what those are, and I get them to her and we keep it. But it now means that as a veterinarian in another zoo, if you don't know what your animal is because you forgot to write it down, or you're in an emergency like we were, and you don't know what to do, then you can call one of us and we can start getting you in touch with 5 people near you, where it used to be you would call whoever you thought you could call at midnight and ask questions. And now we are on speed dial and they know where to get us. It's a collaborative effort across the species. So we've done orangutans and chimpanzees and bonobos and gorillas. And we've outlined quite a few of the places to start. And we so now it's not just a shot in the dark. You actually can go and say, well, this is my best blood donor for this situation if I have to be in my own zoo. But what's really great about that is we now can be like, let us help each other. We can help you from another zoo, because if you're going to a blood donation, you probably have your hands full with the reason the blood donation needs to exist. So we work through that. So it was a real privilege to be part of that, and kind of fix that old thing, that why we didn't do it for the apes in the first place. So it's been kind of an interesting effort for that.
Yeah, and it's something that just sort of lives on forever, and it can just like continue to be adjusted. I think a theme that I keep hearing about, not only in veterinary medicine, but everyone we've talked to so far, is like, it takes a village, and there's a lot more people involved than you might think. And so I think that's another great example of just the collaboration among AZA zoos, but also Veterinary Association and all these other areas. One thing that is really cool here that we have is the residency program, and our residents not only get to practice here, but at different zoos and aquariums. So what does that look like, and how did that come to be, and why is that important?
So training the next generation is a commitment, and that's the next generation of any job at Lincoln Park Zoo has been a commitment that Lincoln Park had. It's one of the reasons I came here, because I could tell when I applied for the job that was a commitment that was here already, and it was something that was very, very important to me, because we're not going to be here forever, and succession planning is really critical to make sure that all the things we've learned carries forward, and so we're not relearning old things that we should already know, and we can move forward. And one of those is a residency. And so again, that's basically after graduate, couple of years, then you're really focused on whatever the species or the technique or the discipline it is. And we are the only zoo outside of Europe that has both American and European College of Zoo Medicine residency status. There's a couple that are European and there's some that are American, but we're the only one that has both. And it allows our residents to do a rotation in Europe for about 90 days to experience. They're not working, they're just experiencing what's going on and learning about the different challenges firsthand. So I can tell them all about it, but they need to go and see what that looks like. The same problems we have, but in a different lens, through a different lens. Yeah. What are the challenges with housing animals with different temperatures, with moving animals between countries? We move them between states, which have their own rules, and that's different countries, and how do they handle those processes? Like I said earlier, the diseases are interesting because it's not like the diseases are like magically jumping between. It's just climate change has happened and things are moving with commerce and things move over. And now suddenly there's a population that hasn't experienced it before and now are experiencing it and changing. And we're very careful about like what that looks like, educating across the globe. But we like to be able to have our students see that, come to the United States and learn. So we do an exchange with the residents in the European colleges of medicine. They're available to come here as well. Again, it's an observational thing and it's experiential thing, so they can learn and see it for themselves. But that's how it came about. It's just an important commitment, and so they are the fourth of our vet cadre where we have one in training all the time, which is really it's a great commitment that Lincoln Park Zoo made, and we were very fortunate that a donor, Gene Griggs, saw that vision and endowed the position several years ago and made it going to be in perpetuity, which is great. Which we really appreciate her doing that.
I think that's so interesting. It's also just the perspective shift of, Europe is not that different, and also the diseases are a little different. Yeah. The access to drugs, the regulations are different.
Very different.
The philosophies are different.
Right.
So, we all continue to learn all the time, and so just adding that perspective to the pool of knowledge is so great. Yeah. Not only are you one of the most, in my humble opinion, accomplished vets, you also have a whole resume of other things outside of the zoo, including a chef, a cordon bleu chef. You can speak multiple languages.
Just the one. So.
More than one.
Yeah.
You travel all the time. What is your what is your favorite thing to do when you're not Dr. Kathryn on Lincoln Park Zoo grounds?
Well, I'm always Dr. Kathryn. It doesn't matter whether I'm on the grounds or not, because anybody can call me anytime. So, but I certainly do enjoy cooking and experimenting with that. And it's funny because I find a lot of different options with it. And in fact, this morning it was interesting. I was on a conference call at about 5 this morning with Japan because I have a person there that I'm mentoring that we were consulting on a case, and we were talking about just the basics of taste, and that animals and people have bitter and sweet from very beginning, because bitter bad, sweet good, and it helps to teach the brain where to go and what's poison and what's not poison. And we were talking about the fact that they were having difficulty getting meds into this particular animal, and because it tastes bitter. It's giving the brain the wrong signal. And basically what I suggested was avoid sweet and maybe try like a savory. So it's Japan, so I was like, try miso. Try soy sauce. Try something that is a different taste profile and why. And they were like, oh my gosh, that's such a good idea from a chef. That's great, so you put the different hat on. But it's things like that are interesting to be able to kind of merge them all together. But mostly I'm, what I am is who I am, and that it's hard to get away from that.
Yeah. Awesome. Thank you so much for joining us today.
Thanks for inviting me.
Appreciate it.
Of course.
All right. Stay tuned to Lincoln Park Zoo's YouTube channel and our social media channels at Lincoln Park Zoo to see future versions of our podcast.